بدنا نستنى نتكلم معكم بخصوص دكتور تالي. أنا عارفة إنه الوقت متأخر كتير عليكم في العالم العربي. مرحبا، كيف حالكم؟ إن شاء الله تكونوا بخير. رح أعزم معانا هلأ دكتور من بيفرلي هيلز. Hi Carmen, how are you? Sorry, it's gonna be a bit in Arabic and a lot in English too, so half. So stay with me live. I'm gonna invite Dr. Bentali from Beverly Hills, who's talking about facelift, to join us in this conversation. رح يشاركنا دكتور بنتالي هلا من بيفرلي هيلز. خليني أضيفه معنا على الفيديو. لحظة. طبعا أنا عم بستنى من دكتور تالي يدخل معنا لايف علشان نتكلم شوي على الأورا ليفت. Hi, how are you?
I'm here. Fantastic.
Very nice to see you.
You too.
All right. You kind of made a little bit of an earthquake with my followers talking about facelift.
Okay.
Because we all want to look about beauty and natural looking. And this is what I'm after, is a natural looking people moving on earth.
Yes, me too. Only that.
أنا بقول لدكتور تالي إنه إحنا بدنا الناس اللي بتكون موجودة على الأرض تكون شكلها طبيعي وحلو من شد الوجه. So, Dr. Tali, I have a few questions for you about aura lift. We're gonna talk. I know you do the lip lift and you do a lot more things, but most of the people now is asking me about the aura lift. The questions I sent to you was, when you do the facelift, can I do just my neck? Can I do just my face? This is a question. سؤال كتير سألوني إياه كل الناس. إذا بدي أعمل الأورا ليفت مع دكتور تالي، في أعمل رقبتي لحالها، في أعمل وشي لحالها. فخلينا نسمع منه إيش بده يقول. Go ahead.
Yeah, so the understanding of facelifts has been a bit confusing over the past, I think, 30, 40 years for people.
Yes.
The thing that we have to understand in general is that the general access points, meaning the way that we get in to do whatever we want to do for a lift, is from around the ear. Okay, that's for most types of facelift.
هذه المنطقة اللي الدكتور عادة العمليات التقليدية بيعملوا فيها العملية اللي هي حوالين الأذن.
So when we go in there, we have access to the face, to the jawline, to the neck. We have access to this area from here.
هاي الطريقة التقليدية اللي بيدخلوا لها بس من الوش من التحت زي ما هو بيأشر على وشه.
So most people, when they come in, they ask for a facelift or a neck lift, and in general, it's the same surgery.
Okay. So in the old or the new way?
The classic, the
okay. الطريقة التقليدية عادة الناس بتطلب شد الوش، عادة الوش الناحية السفلية منه.
Yeah, it's generally the same surgery, which means that probably 90+% of the world, when you're doing a facelift or a neck lift, it's the same, and you're actually lifting the jawline and the neck. So it's usually called a lower facelift, is a classic facelift or neck lift.
هذه هي الطريقة اللي بيشدوا فيها الوش، اللي هي المنطقة السفلية من الوش.
Okay. In that, some people just call it a neck lift, and maybe they try to do just a posterior cut and move it that way, or they try to do little limited types of mini lifts and things like that. But that's not a very smart thing to do, because the face and the neck, they droop together as you age. It's connected. This is one piece. It's not.
يقول الدكتور الطريقة الكلاسيكية بتخلي الوش بعد فترة يعني بمعنى آخر بيتبهدل، لأنه بتنزل الجزء السفلي منه وتضطر إنه هي تعاد مرة ثانية.
So when we go in and lift, the more you release of all of this area, the better lift you're going to get. So if you really want the best neck lift possible, you have to actually release this part, and this part, all of it. So it all comes up together with no restriction. It's all one piece.
So the aura lift, which is what I'm telling the people, it's the new school of doing a face lift, addresses the neck automatically. So there is nothing that I would come to you and say, can you do only my neck?
Correct. It's actually the best way of doing a neck lift, or the best way of doing a facelift. It's a combined face and neck lift, and the idea has changed from the old school idea of stretching, pulling, and tightening.
Yes.
Now what we're trying to do is actually get into the face, release all the attachments. Everything that's attached to the face is drooped over time. We release it and we take everything back up with no tension and put it back where it wants to be.
Oh, beautiful. Beautiful. فاللي بيقولوا أهلا فيكم كلكم اللي عم بتسلموا علي، شرفتوني. بس أنا بديش أقاطع الدكتور شوي، بدي أسأل. بيقول الدكتور إنه هو طريقة المدرسة الجديدة لشد الوش هي الطريقة اللي بينشد فيها الثلاث طبقات مثل ما أنا قلت بالفيديو اللي قبليه. الوش له طبقة الجلد وفي طبقة الدهون والعضلات، هذه كلها في الطريقة الحديثة بينعمل، بتكون موجهة العملية إلها علشان تشد الوش بشكل كامل السفلي. So when you tells me and some of the cases that we're getting, you tell me that they need a brow lift. Is that because the aura lift does not address this half, right?
Correct. So the aura lift is a combined face and neck lift. You're lifting here, so it means your under eye will get better, your cheek contour will get better, your nasolabial folds, jawline, neck, and even your upper chest down here, this gets lifted. So that's the aura lift. When we're looking at the eyes, the lip, the nose, that's a separate area. It needs a separate access point. So the eyebrows, they droop like this over time. And when we want to lift them back up, we have to take them back up. So we can't take them this way. That doesn't make any sense. We have to come from up here, make an incision in the hairline, come down, release it, and bring everything back up. So that's an eyebrow lift.
Okay. And how many percent of the, let's say, the age 55 to 60 would need both the aura and the...
It's pretty high because when your face droops that much, it's uncommon for the brow not to droop as well and get heavy on the sides. And the way that I do it now, it's not like the classic brow lifts where everybody looks surprised and shocked. It's not like that anymore. Now it's a very natural version of that because we're not pulling, stretching, or tightening. Again, just like the facelift, we go in there, we release all the tension, and we take it back up to where it wants to be. So it is more of a restorative procedure where you're restoring someone rather than trying to make them into something new and different. You're not doing that.
بيقول الدكتور أنا عم بسأله إنه هل ضروري العملية شد الوش يكون فيها عملية لرفع الجفون برضو؟ طبعاً اللي عمرهم 55 سنة وفوق قليل كتير لما بنلاقي إنه الحواجب، منطقة الحواجب والجفن ما نزلت برضو مع الوش، فبالتالي بتنعمل عملية الأورا اللي هي بتعمل اللفت للجزء التحتاني من الوش لغاية الأول بداية الصدر، وبرضه بتنعمل اللي هي رفع الحواجب بنفس العملية. Some people are asking like how old is your patients to do this?
So nowadays the patients are typically between 45 and 55 years of age.
من 45 سنة وطالع طبعا.
Yeah, and in
what about the weight loss people, the ones who lost a lot of weight?
Oh yeah, that makes a big difference. But I'll tell you, in my practice, I actually do patients from 25 to 85.
بيقول من 25 بيعمل ل 35 تقريبا وطالع.
Yeah, and the reason for that is it's a new kind of lift where if you have heavy cheeks, if you have a saggy jawline, neck, it doesn't matter how old you are.
Correct.
I can lift everything consistently without any problem and very safely. So it does apply to more ages than it used to. As far as the weight loss patients, it's a huge benefit for weight loss patients. Weight loss patients.
Just one second, Dr. Tally.
Of course.
Dr. Tally بيقول الأعمار اللي بيعملها هون في البراكتس ببيفرلي هيلز بيعمل من 25 وطالع. كتير بيعمل من 25 تقريبا ل 35. بغض النظر عن العمر، إذا الخدود ثقيلة والدقن والمنطقة الخدود نزلت ارتخت، فبالتالي العمر ما بتفرق سواء الواحد عمره 20 أو عمره 80. بس طبعا هذه بالنسبة للناس اللي العمر هو اللي خلى الضعف في العضلات هذه وخلى الوش يصير مرتخي كتير. بالنسبة للناس اللي بتخسر وزن ضروري كتير برضو نعرف ما بتفرق معاهم. So let's talk about the weight loss ones اللي بيخسر وزن.
So with weight loss, the patients with weight loss, they've had a lot of bony changes to their face, so their bones do get a lot stronger over time. And when they lose weight, the aging process becomes very rapid. It's very quick. They deflate very rapidly. So for those patients, we actually have to lift them, and it makes a huge difference because they can actually remove all the excess skin that was formed over time. But we also have to add volume back in because as they lose all that body weight, they're also losing a lot of weight in the face. And even if you lift them, they're still missing that volume. You have to add it back because right now you're looking more at skin and skeleton. They don't have fat in their face anymore.
مزبوط. اللي بيخسروا وزن كتير بيخسروا دهون معاها موجودة في وشهم، فبالتالي بيستفيدوا كتير من العملية هذه لأنه الدكتور بيشيل الجلد الزايد وبيشد لهم اياها بغض النظر ايش عمرهم. هذه رقم واحد. واثنين، لازم يعطيهم يحقن دهون إلهم في المناطق المهمة كتير علشان هم خسروا دهون من وشهم، فبالتالي عمرهم ببين كتير كبير، فبيعطيهم بيرجع نوع من النضارة والجمال يعطي عمرهم الحقيقي. اللي بيسألني على الرقبة، عملية شد الوش بتشمل الرقبة معها لأنها نفس المنطقة اللي بتنشد فيها بنفس عملية الأورا. They're asking about scars, العلامات اللي بتبقى من بعد العملية.
So the scars, with the way that I do the aura lift, I tell the patients good luck finding them. It's
I love that.
It's the doctors and patients, they think that the reason people scar on the face is because of their skin type or because of how it was stitched. Most often it's actually because of the amount of tension that's on it and the changes that were made in that area. So if you do a facelift or a neck lift and have no tension on the closure, so there's no tension anywhere in the lift, the incision heals like nothing. And I never call it invisible, but it is barely visible. And it is very difficult to find even for me.
I tried to look it up on the pictures you guys have, and I just could not find those scars.
Yeah,
and I looked in videos when you are recording them, and thank you so much for not using Photoshops and all this. احنا بنقدر الدكتور لما ما بيستعمل الفوتوشوب تكنيك اللي بيصلح وبيغش فيها في الصور، فالدكتور رائع بيصور الصور مثل ما هي. فبيقول لكم حظ سعيد انه انتم تلاقوا مكان العلامة بعد العملية، لانه هو بعد فترة هو نفسه ما بيعرف وينها، لأنها بتختفي لأنه هو ما شد ولا مط الجلد، وهذه حاجة مميزة كتير بالطريقة اللي بيعملها فيه. Yeah, go ahead, Dr. Tally.
With all the facelifts that I've done, and I do a lot, nobody has ever complained about the scar or the incision. They're very, very, very hard to see.
And ما في علامات بتبان أبداً.
Yeah, and people don't understand that until you see someone in person who's had it. You cannot tell. I even saw a patient today that I hadn't seen in about a year, and I couldn't remember what I had done on her. I thought maybe, okay, I did Botox on her one time. And so I'm looking at her and I'm thinking, okay, like, why is she here? Why is she here? And I don't want to be embarrassed to tell her I don't remember exactly what I did. So then I look in the chart and I had done a facelift, a brow lift, upper lower eyelids, and a lip lift on her. And you cannot tell.
Why is she at the clinic?
She's here for follow-up. She came back. She's from another country, and she was here for follow-up.
Great.
And I couldn't tell. And I'm a specialist in this. I can identify anything that's off. I could not tell one part of it. She looked like somebody who's never had anything done to her, not even Botox. And I went and took the pictures of her, and her before and afters are substantial. It's a big
beautiful. بيقول الدكتور بالنسبة أول شيء الدكتور ما بيتكلم عربي. He doesn't speak Arabic. Somebody is asking me.
Yeah, I just know
he
bad
looks
words.
like it, but he doesn't.
I just know bad words, so we won't use those.
I don't want to hear them.
Yeah.
So ما بيتكلم عربي، بيقولوا محافظينه شوية كلمات مش كويسة فمش رح نسمح له يقولها. بس بيقول إنه اليوم كان في عنده مريضة في العيادة عاملة الفيس ليفت من زمان كتير وشافها اليوم عشان تراجع، وما قدرش هو نفسه يحذر ايش العمليه او يتذكر هو ايش عملها، لانه وشها كتير طبيعي ومش باين عندها اي شيء. فاحرج لعند ما شاف الملف وهو شاف انه هو كان عاملها شد للوش وللشفون من فوق. I'm just going to look at more questions, more about scars. We already talked about scars. There's something in Spanish there. Maybe you can help me with. How is the fat in the temples, eyes corrected? How is loss of fat in
loss of fat,
and eyes?
Yeah, so when you lose fat in well, first, people have been over-injecting the temples. They inject too much because it's a new thing that doctors have noticed. They get very excited about it, and they've been overfilling, and everybody ends up looking round like this, and it's not great. The shape that we're looking for, the contour that we're looking for, is a slight slope from the temple coming down to the cheek and the cheek coming back in. So you have to have that contour. The reason we fill is because the brow bone is here, and if you look past it, there shouldn't be any hollowing. It should kind of go smoothly back. So if somebody has that hollow, and it could be here, it could be back here even, you can fill that with either filler or fat. Sculptura, which is the other option, doesn't work so well. So we use either filler or fat. Filler is very easy, you put it in no problem. Fat is very safe there because you put it deep. The problems I've seen from fat are when people inject too much or they inject too superficially. And fat, although people think it's natural, it's not natural. It's from another part of your body and you bring it here. So let's say you're a woman who's 30 years old and you get it injected, and then you turn 50 and now you're having hormone issues. The fat can grow and then you're going to have a big giant head. Yeah, so you have to, and this has happened to people. So you have to be very conservative on the amount that you do and never assume that fat, just because it's your own fat, is not going to have any problems.
I'm gonna explain this part. دكتور تالي بينبه عليكم كلكم للي سأل على الدهون، خسارة الدهون من الأطراف الجوانب هاي، بيقول إنه بليز ديروا بالكم من حكاية الحقن في المناطق هذه. الستات اللي مثلا البنات اللي عمرهم 30 سنة والستات 30 وطالع وبيحقنوا مثلا في المناطق هاي، لما بيكبروا بيصيروا 50 سنة وبتتغير الهرمونات النسائية عندهم وبيزيد الدهون، المنطقة هذه رح تكبر ورح تعرض ورح تصير تخينة ومش حلوة أبدا. والحقيقة أنا شفته في كتير كونسلتس بعملها معاه إنه هو بينتبه على طول وبيعرف إنه كان في حقن قديم هون، والست عمرها تجاوز ال 45 وصارت اختلاف في الهرمونات عندها. فهذه نصيحة حقيقة كتير مهمة من دكتور تالي بنتشكره عليها. وهو عمل فيديو تاني برضو على حكاية تدويب الحشو أو الفيلرز بالشفايف، يا ريت تنتبهوا عليها برضو. I'm gonna refer them later for that video you made about the dissolving of fillers in the lips. I really appreciate it. I saw it today and I just, or yesterday maybe, and I really appreciated it from you because I see the women, I see them with the dimples, and I see them with ways where they are trying to dissolve it, and they go for people who didn't really explain it. I never heard the way you explained it today in your videos earlier, or I think yesterday. But I'm gonna repost it. I'm gonna ask Joseph to give it to me. I really have to repost it because I really want to educate people to find the right things to do. So we appreciate those little insights from you.
Of course, yeah, it's my pleasure.
So they are asking you about lip lift. They're asking a little bit for you if you can tell us about the lip lift. إيش بدكم بخصوص الشفايف اللي بيسألني على lip lift? Can you tell us like how long is the surgery for the lip lift? How long does it take?
It takes about 20 minutes. It's about
تاخد 20 دقيقة عشان عملية رفع الشفايف. And
so
healing from it?
So I do a lip lift a very different way than other doctors do. So the healing time that I have is actually longer, but the end result is safer, more consistent, and a bigger lift. So I can actually lift more than other doctors can safely without causing problems on many people. So the procedure itself takes about 20 minutes, 30 minutes, and
20 دقيقة مدة البروسيجر تبعت رفع الشفايف. Go ahead.
Yeah, and the incision goes across the base of the nose.
هذا المكان اللي بيعمل فيه فتحة الندبة تبعت العملية.
And you have the stitches in for about 5 days.
5 أيام بتضلها الغرز.
Yeah, the first week it's huge. The lip is like this and it's weird and strange. The third week it becomes presentable or passable where other people shouldn't notice but they can. 2 months, one side is swollen, one side's not because the body heals asymmetrically. 3 months it's perfect. 3 months? Yep, takes 3 months to be perfect, and it's the smallest procedure that makes the biggest change.
بيقول هي عملية بتاخد وقت كتير قصير وبتعمل تأثير كتير كبير رائع. بيقول هو بيعملها بطريقة خاصة كتير بتبقى لفترة طويلة وأمينة وما فيها أعراض جانبية، لكن التعافي منها شوية أبطأ من العمليات اللي بيعملوها كل الدكاترة التانيين. يعني على الأسبوع الثالث ممكن الناس اللي ما بيعرفوكم كتير ما يعرفوا، بس بتكون شكلها جميل جدا، يمكن يكون لساها فيها تنفخ شوي، بس بيقول أحلى شيء النهائي إلها بيبان بعد 3 شهور. Someone is saying that they had the Beverly Hills facelift and it was really great. Oh, she's actually saying that she did a facelift and she had keloids after that.
Okay.
Not at your practice, somewhere else. So what do you say about that?
So most people who have scarring from a facelift, it's called hypertrophic scarring, which is different than a keloid. It means it's just thickened, red, and raised. And that happens from tension, like we were talking about. When you put two pieces of skin together, and if there's tension and they're fighting, as they fight each other, the skin starts to grow into a little gap, and then it starts to try to thicken. So that's a scar. When that happens, you have to either cut the scar out, or you have to try to treat the scar with lasers or PRP, microneedling, you name it. If it's under tension, it doesn't matter what you do, you can't really get rid of the scar. You can only blend it a little bit. So for people with a facelift with bad scarring, really bad scarring, the only way to get rid of it is to do another facelift that has no tension. So you have to go back in there, and the first doctor just took a little bit of skin, released it, pulled it, but had tension on it. It's scarred. So now you have to go release everything, bring it up, cut out more skin, but leave no tension. And then now it's going to heal well.
هلا بيقول الدكتور بخصوص الناس اللي سألت عاملين الظاهر عملية التجميل تبعت شد الوش وترك لهم علامات سميكة في الوش، فبيقول الحقيقة الحل الجذري إلها إنه هي يعيد العملية علشان يخفيهم، أو إنه تستعملوا ليزر وتستعملوا أشياء تانية سطحية علشان تخفف منها حسب إيش السماكة واللون اللي هي تحولت إله، فبالتالي لازم يقدر يشوفها عشان يقرر أي اللي أفضل لإلكم. Somebody is saying, can you release the concerns of the lip as well if needed? The corners. Can you release the corners?
Yeah, so the way that I do it, there's two ways to do that. The first way is you do a lip lift from the middle all the way across here, and you can actually go out and release the corner to reveal the corner, meaning if this is buried like that, you can actually reveal it. So that's called a corner release for an upper lip lift. Somebody else, I'd say, well, their nose is here, the lip goes all the way out here, it's long. And so something here can't fix that. So I have to make a cut here to release it. So that's called a corner lift, and that can easily be done. The issue
Does it have healing time? Is it long in healing
it's
time?
Short. It's short healing time.
التعافي منها سريعة إذا بده يفك الكورنرات تبعت الشفايف.
Then there are a corner of the mouth that goes down problems. That's totally different. People think it's the same. They're very different. So here it can get deepened, darkened, and it can point downwards. That it can be improved with a facelift if the face is causing the weight, or you have to do filler to pop it out and Botox to relax the muscle. So it just depends on the cause of that. But that's a different problem than this.
Yes. هلا الكورنرات تبعت الشفايف مختلفة تماما عن حكاية رفع الشفايف، ورح أشرح عنها بعدين عشان نختصر في الوقت شوي. They're asking about the cost of facelift in general. I think it varies, right? And
yeah, it's in Beverly Hills. They go anywhere from about probably, I'd say the low end is about 8,000, and the high end, well, the highest end is 170,000, but the real high end is about 70,000. So the average from somebody good is usually in the 20 to 40 range.
Right, which is very reasonable. عمليات شد الوش بتبقى تقريبا من 20 ل 40 ألف الحقيقية في بيفرلي هيلز هون. طبعا في ناس بيبالغوا كتير وبتوصل 170 ألف دولار، بس اللي بيتابعني وبيعرف إنه أنا بجيب دكاترة معينين جدا هم الحقيقيين في هالحياة، راح يقدر ويعرف أهمية إنه أنت تكون عارف مين هو الدكتور.
There's a question about PDO threads.
Yes.
Yeah.
بدنا نتكلم عن حكاية الاستعمال الخيوط في الشد. Go ahead. You tell us. Do you do it in your practice?
I'm a good doctor, so I don't do much of that.
Oh my gosh.
I'll explain. There are reasons to do it. It's not a terrible thing, but
okay.
PDO thread is polydioxanone. Polydioxanone is a synthetic suture material that gets absorbed over a long period of time. Because it takes so long to absorb, it causes scar formation in the face, and that's part of how it works. Okay.
بيتكلم على الخيوط، بيقول انه هي بتعمل ندبات في المنطقه اللي من تحت مكان ما بيدخلوا الخيوط فيها، وهذه ايجابيتها وسلبيتها مع الوقت بيعتمد بيتكلم عليها.
So when someone says the thread is in there and it's tightening and forming collagen, it does, but it's doing it in the form of a scar. So it's not really healthy collagen, it's unhealthy collagen.
بيقول لانه الكل بيعمل دعايه الخيوط، بيقول انه هي بتبني كولاجين تحت الجلد، بيقول مزبوط بتبنيه، بس بتبنيه كندبات، ما بتبنيه كالكولاجين اللي احنا بدنا اياه يكون موجود عنا طبيعي. So
and we can use bad things to our advantage. Okay, like
فينا نستعمل اشياء سيئه لمصلحتنا مثل.
Yeah, so there's Botox. Botox is a poison if you ingest it, but if you inject it, it works nicely to relax muscles. So we can use bad things to our advantage. The issue with PDO threads or any kind of thread is that they've never been shown to be very effective. They've had limited efficacy in the best case in the world. So from 2000 till 2013, they were very popular. And the popularity went away when people saw that people were doing threads over and over again and not getting much improvement or having complications half the time. Half the time they would have a dimple that formed or stiffness because your face moves and you go and you put in a thread to tighten it and it stays in there. Your face can't move fully normally. So people were having issues with it. So the doctors
what affects you in your surgery? If somebody comes to you to do the facelift and let's say he or she done threads, would that affect the aura lift?
It affects my finger. This finger gets very calloused and hard because it's so much more pressure to go through the face because there's scarring in the face. The PDO threads cause a lot of scarring in the face.
I've seen videos where they're promoting a huge amount of threads.
Of course,
it's scary.
Yeah, but there's no facelift surgeon, someone who's really good at facelifts. There's no good facelift surgeon who tells people to do it because they're always in the face and they see what it does. It's usually the doctors who do non-invasive things and they want to have another tool to use to improve the face. So PDO threads can have a benefit. Okay, they can have a benefit if someone has an indentation somewhere and they're never going to have surgery or it's not a good idea to fill them and you want to stiffen the area, you can do that. But the problem I've seen is that people try to use PDO threads with a very big imagination and they are not tied into reality. And we're doctors, but it doesn't mean we're realistic.
It is very popular in the Middle East, Dr.
Of course. Well, it makes money. So threads can have a benefit. The place it cannot have a benefit, impossible to have a benefit, is the eyebrow and the lip.
بيقول لا للخيوط بشكل كتير كبير في المنطقة اللي فوق ولا أبدا للخيوط في المنطقة اللي هون.
So
بيقول الخيوط هذه ما في جراح شاطر وبيفهم وبيعمل عمليات شد الوجه وبيوافق على حكاية الخيوط. Go ahead.
So if it can't have a benefit, it means it can only harm you. So anybody who's doing threads here and here, they're just hurting you. They're not really doing anything beneficial. And they can come up with a million explanations as to why they do it and come up with their reasoning, but it's all very imaginative. It's not realistic. But there are other places in the face where you can do PDO threads. There's another kind of thread that does work. There's a doctor, Dr. Mueller, who's down the block over here. He does a very impressive thread lift, but he's not a normal doctor. He's very good. And he goes and he actually passes the thread 20 times through here and through here. He does it's a trampoline type lift. I don't know what he does, but it's impressive. But most doctors don't have that talent.
بيقول الدكتور اللي بده يعمل الشد عن طريق الخيوط لازم يكون فنان كبير ورائع فيها، غير هيك بتضر ما بتنفع. البوتوكس أحسن منها وبيفيد أكتر. Somebody is asking you, can you remove PDO threads?
No, you don't need to. PDO threads are dissolvable. They're going to go away on their own. And for most people, they don't cause any issues. They just go in, they stiffen up the area, they give you a small amount of improvement in addition to filler. And it goes away eventually. Behind it, it'll leave stiffer skin. Most people, that's not a problem. Some people, their skin gets rocky. It gets rigid. It's not soft and smooth anymore.
بيقول انه حسب طريقه البشره برضه ما في داعي انه الواحد يشيل الخيوط اذا حطها، بس في بشرات اوقات بتتجمد تحتيها، يعني بتصير ناشفه كثير والمنطقه بتصير متصلبه، فسيئه جدا. بيقول على دكتور مشهور كثير كبير هون بيعملها بطريقه رائعه، بس ما في حدا مثله ممكن يعملها زيه وهو مبهور فيه. So I think I'm just looking for the other the cost of lip lift. And do you need to dissolve the fillers in lips before you do the lip lift?
So the cost of a lip lift, it's typically between, for the good people, it's between 4,000 and 20,000. The best the best doctors are usually around 7,000 or 8,000 in that range. The filler does not always have to be removed. The filler that causes most problems out of the hyaluronic acids is Juvederm. And if that is found up here in the mustache line, I always advise removing it before doing the surgery so you don't cause prolonged healing and swelling.
بيقول الفيلر الوحيد اللي لازم يشيله اذا بده يعمل رفع للشفه اللي هو الجوفيديرم، وفي فيديو خاص هو عمله عليها بيشرح من فين يتذوب. بيقول بس بالتكلفه تبعتها بين 7,000 اظني قال ل 8,000 عند الدكتور الشاطر، يمكن شوي تكون اغلى اذا في مشاكل بالشفه. Yeah, go ahead.
So I tell patients that dissolving filler is safe to do if you do it well, but can always cause problems because you're shrinking your own tissues when you do it.
Are we talking about the lips?
With a dissolver for lip or for anywhere.
Can you say that again? I didn't pick on that.
You always have to be careful doing dissolver.
Oh, okay. لازم تنتبهوا كثير على حكاية تدويب الحشو أو الفيلرز، لأنها ممكن تغير من شكل الشفايف. So we have to be careful when they dissolve it because it will shrink the area.
It can shrink your own tissues, and the area where hyaluronic acid exists is in the dermis of the skin and in the SMAS, which is the layer underneath it. Those are the main areas that you're going to find it.
ممكن تعمل تضاؤل في النسيج جسمك نفسه، نسيج البشرة نفسها، بحيث إنه هي تنكمش زيادة عن اللزوم أو تتصلب. Yeah.
Right. Yeah. So there's someone asking, what's the name of a good doctor for a thread lift? The good one that I'm talking about, the complex one, is Dr. Mueller. The simple ones, the ones I've seen that go well, are by Dr. Karimi. Kian Karimi does them very well.
All right, thank you. You're generous with the information. I'm just trying to find some more questions because there's a lot of questions. Traditional facelift, better lift. I'll just do the traditional facelift, better lift. So I don't understand if this is a question or
I think she's just saying she's going to go do a transitional facelift. Yeah. Yeah. How do laser treatments like Morpheus 8 compare to a facelift? So, so that's a radio frequency treatment, Morpheus 8. So there are two devices that are transcutaneous needles that exist. Number one is Profound. Number two is Morpheus 8. The strongest that exists is Profound. Profound is substantially stronger, safer to do repeatedly than Morpheus 8, but Morpheus 8 is a great device. The way you use them is Profound is done once, and it's needles that go into the skin, and it blows the face up for a week, and it will improve the shadowing of the folds and the jawline and the jowl, everything about 30%. Morpheus 8 can be used different ways because it can go 1 millimeter to 4 millimeter depth straight down. It can't get to the same intensity as Profound can, but it can do a little bit with less downtime. So Morpheus 8, you're usually repeating a couple of times to 5 times, depending on what you're trying to do, and it can give superficial skin tightening. Not as good as Profound, but pretty good. The benefit of Morpheus 8 is that it comes with another device called FaceTite or AccuTite, which is a wand that you can place in the neck, and it acts like liposuction, shrinking the fat and shrinking the skin. Profound can do that too in a different way, but Morpheus 8 and Profound are both very good devices. All the rest of them are...
Age group, Dr. Tally?
Oh, anything. It's pretty much from mid-20s to 80, you know, it's fine to do, and they're very, very safe as long as they're done by somebody who knows what they're doing. Yeah, but those are the two good devices. The other ones are great devices for just superficial stuff. The bad devices, or the ones to really be careful of, is Ulthera, Thermage. Like, you really have to be careful with those devices because they tend to make people look older.
Oh.
Yeah, it's the opposite of what you want.
بيقول الدكتور اتكلم على 2 من انواع الليزر، راح اتكلم عنهم بالتفصيل بعدين، بس بيقول ان 2 برضو تنتبهوا عليهم اللي هي الثيرماج والالتيرا لانهم بيبينوا العمر اكبر بالنسبه للوش. بس في 2 تانيين من انواع الليزر كتير مهمين، واحد بيدخل اعمق من الثاني، وواحد منهم بيحتاج انه يتعاد اكثر. I'm going to talk more about the lasers. I'm going to put it in a separate in Arabic so I can explain what you said. I'm looking at other questions that silicone fillers, injections, how hard can they removed?
Cannot. So it's impossible to remove silicone filler injections fully without removing all of the tissue. So let's say you have silicone in the lip. The only way to remove it is to remove the lip. You can't remove it. Once it's injected, silicone integrates into the tissue like a sponge. It doesn't stay there like beads. It's a sponge. So it gets soaked into all the tissues. So you can't remove it. There are doctors who say they can liposuction it. Generally, it's not true because they're liposuctioning fat and maybe there's silicone in the fat, but they're really removing fat and other tissues, and then they have to, which is debulking it, it's making it smaller, but ultimately it causes a lot of irregularities. So you can't really
scar tissues and all, right?
Yeah, and it scars and it causes more irregularities. So you can shrink it sometimes, or you can do other procedures to make it look better, or if silicone is causing a bump, you can cut the bump. You know, simple things like that. But in general,
بيتكلم الدكتور عن الخطر تبع السيليكون واستخدامه في حقن الوش. لازم دايما تتأكدوا وتسألوا كتير قبل ما انتوا تعملوا اي حاجة في جسمكم، وهذه هي الضرورة من حكاية السؤال والتعليم في التجميل. Yeah, Dr. Zah, I just want to always tell patients they really need to look into options. They need to read and they need to understand and follow the right doctors.
The only type of injectable I've seen that you can kind of remove is bioalchemid. So bioalchemid, it's a creamy type paste, and if you put a needle and you push on it, sometimes it squeezes out.
But is it used often for fillers and all?
No, thankfully it's off the market. It's not used anymore. But it was one of the permanent fillers. Nobody should use permanent fillers. You have to have a very strong reason to use a permanent filler. Permanent fillers can be very harmful and they're very poorly predictable. So permanent and semi-permanent fillers should be avoided.
ديروا بالكم من الحشو الدائم. احنا مضلنا نقول عليها لازم ما ترجعوا للحشو الدائم لانه بيصير مثل الاسمنت وبيتحرك وبغير معالم الوش كلياتها باختصار. So Dr. Tally, can you tell us about Dubai? You are going to Dubai really soon and we are all very excited. الدكتور رايح على دبي قريب جدا وانا مبسوطة كتير في زيارته. هي مش زيارته الاولى بس ان شاء الله بتكون رح يستكملها بوقات منتظمة. So you're going to be seeing patients that we already consulted with on videos.
I'm just going to go to restaurants. That's all I'm doing. I'm going to go to dinner like Korea.
Your followers is going to know and my followers and they're going to be looking out for you.
That's all I'm going shopping. That's all I'm doing. But, yeah, I'm going to Dubai next week. I think I'm leaving on Friday or Saturday and I'll be there for a week and I'll be going probably 4 or 5 times this year. We're working with a new clinic over there and I'll be seeing consults and doing surgery as well.
I know that you're doing a lot of surgeries that's already scheduled because we did a video consults with them.
Lots.
Which is good because it saves time and you are seeing the right patients. So
I do a lot of video consults. So every day I'm doing video consults. Plus Tuesdays I do like 20 in a row. So
واو. اللي بده يعمل استشارة على الفيديو مع دكتور تالي فيكم تبعتوا لي على الواتساب أي وقت وأنا برتب لكم إياها، أو إنكم تبعتوا فيديو بيصور الوش كامل أو المنطقة اللي أنتم بدكم إياها بوضوح، وكل الفيديوهات هذه خاصة وما تنشر ولا بتروح على أي من السوشيال ميديا. So I don't want to take much of your time. I know you had a very long day. We just got you out of surgery. I really appreciate your time always, Dr. Tally. We need to see you more on video. And I'm going to be there in Dubai. So we're going to run a lot of short videos there.
Wonderful. I love that.
All right. Thank you so much. Really appreciate it.
Of course. It's my pleasure.
All right. شكرا لكم جميعا. بتمنى لكم كل الصحة والعافية وإن شاء الله تكونوا استفدتوا.